We're live. Hello, everyone, and welcome to this week's episode of Jump In with Jumi. I am your host, and I'm so happy you all are here again with me this week here on blackdoctor.org. Can you all believe this is my 8th episode? Yes, we are 8 episodes in, and I'm so excited. You all are coming in. As you're coming in and getting settled in, let me know. I want to get to know you all. Let me know if this is your first time watching this show or if you have watched more than one episode. I want to get to know both my first timers and my faithful jumpers. Let me know who is watching for the first time, how many episodes you've seen, if you've seen more than one. I'm so excited that you all are here. We've had such great conversations, including last week's episode on food and fitness, which if you did not see, by the way, you must go back and check it out after this episode, of course. But definitely go and check it out because Dr. Nina Cherie Franklin dropped so many gems that are going to help get us right when it comes to nutrition and exercise. So definitely go and check it out because it is going to get you right. Plus, we had a wellness giveaway. And all winners are going to be announced at the end of today's show. So you definitely want to stick around. Today, though, we are talking about skincare. You know, spring is here, summertime is around the corner, and we have all been cooped up for what feels like a year-long timeout, and it is time to get out and play. But being cooped up has given us all like COVID face, stress, anxiety, overconsumption of junk food, just lack of sun. Everything has contributed to us feeling like our faces are feeling a little dull, a little like full of like lacking life, right? But we're going to change all that today because our guest is going to help get us right. She's going to help us figure out what we need to do to incorporate into our current skincare routines that are going to give us back our glow and, make us feel good when we're taking pictures with our friends and family, filter free. But you know how I do in that I want to know what you know about skin health. And there's so many things when it comes to sunscreen and skin cancer. So I'm going to ask you our question of the week. Do you think wearing sunscreen is only necessary when it's sunny outside, or should you also wear sunscreen when it's cloudy? Let me know. Do you think that sunscreen is only necessary when it's sunny outside or when it's cloudy? We're definitely going to get into this and so much more. And if you have questions, you definitely want to put them in the chat now. Answer that question. Let me know how you feel about things because it's going to be such a great conversation. So make sure you're liking this episode so far. Share it. Start your watch party because everybody needs to get some of this skincare love that you are going to get today. So with that said, make sure you answer that question. Put your questions about skin health in the chat because it is time to introduce our first guest. Our guest is Dr. Kaminska, and she is a board-certified dermatologist and is the founder and medical director of Kaminska Dermatology in Chicago, Illinois. Her mission is to provide evidence-based medical care with compassion and grace. Oh, I love that. Her interests include hair disorders, acne, and hyperpigmentation. She treats patients of all ages and specializes in all aspects of ethnic skin, cosmetic dermatology, and in the prevention, detection, and treatment of skin cancer. Dr. Kaminska treats a variety of dermatology conditions, including moles, acne, warts, eczema, psoriasis, rashes, and unusual growths. She is a well-published scientific author and an experienced media expert. Help me all in welcoming Dr. Kaminska. Hello, Dr. Kaminska.
Hi, Jumi.
Welcome. Thanks for jumping in today. We're so excited that you're here.
I'm so excited to be here. Thank you so much for having me.
Thank you. Thank you for jumping in today. I know this conversation with you is about to be amazing because we all need a glow up. COVID face is up everything, and you are going to set us up and tell us how to do just that, right?
That is right. So, when COVID is over, I call it mask off. We want to look fly. We want to look good. We want to feel good about our skin and about ourselves.
Absolutely. So let's start by you telling us a little bit about you and your work.
Okay, very good. Well, I am originally from North Carolina, moved up to Chicago, to the University of Chicago for my residency, and specialize in ethnic skin, all skin types, but especially skin of color. At the University of Chicago, is Southside Chicago, we saw all skin types. So from very fair skin to very dark skin. And this is important. You want to have a provider that can specialize in your skin and can tell you about how to treat it. So my mission and focus at Kaminska Dermatology is to take care of all skin types, but I do specialize in ethnic skin, skin of color. And I see a lot of acne, hyperpigmentation, rashes, and hair disorders. Since we're getting ready for the summertime, we're getting ready for our glow up, and we're going to talk about that today.
Yes, let's talk about this glow up. Okay, so last week we talked about nutrition and food and exercise and everything like that. And you see a lot of articles that say that you should eat this, drink 9.5 cups of water, do all this kind of stuff. How important is nutrition to getting back to our skin? Like, what is it that we need to be knowing about that when it relates to skin health?
So nutrition is very important for all aspects of our health. And the skin is the largest organ system, so it is a part of the body. Our body is interconnected. We have an immune system of the inside of our body, and we have a skin immune system, but it's all connected. So having good nutrition and a healthy diet is important. So let's talk about water. Water is huge. Water is our substrate of our skin, it's the substrate of our blood. It is what keeps us going, and we need to make sure we stay hydrated. Having hydration makes the skin more plump and more youthful. Right now, one of the most popular ingredients out there on the market is hyaluronic acid.
Mm-hmm.
Okay, you see this everywhere. Hyaluronic acid serum, hyaluronic acid cream, hyaluronic acid. The hyla in hyaluronic acid stands for water. It attracts water. And water is what gives our skin that glow. It does. It gives our skin a glow and youthfulness. So that's why consuming water and making sure we're hydrated is very important for our skin health.
So is there a certain amount, like 9.5 cups seems like a lot. I can barely get through 4. 9.5 cups seems extra.
8 cups is what is recommended, 64 ounces in a day. And it is a lot. Imagine just drinking a cup of water every hour while you're awake, and you should get that taken care of. I have to add a little lemon to my water to make it a little more flavorful, or lime, so that I can get it in there. I'm going to be honest. I don't always get my 8 cups in, but I try my best.
Okay. So in addition to drinking a lot of water, what else can we do to get some glowing, dewy skin? Like, what does dewy skin even mean?
Dewy skin is the skin that's radiant and youthful. So that's what it means. And to get that, it really goes into taking care of your skin health. So usually during the summertime, our oil glands produce more oil, and that can make someone have dewy skin.
Okay.
And this is normal, and people sometimes crave that kind of glow. Some people make too much oil, and we have to tone it down. Some people don't make enough, so we have to add things like the hyaluronic acid and moisturizers that may enhance the skin.
Mm-hmm.
So some of the things that I recommend for that summertime glow up is to choose a nice cleanser. Everyone has different skin. So some people have dry skin.
Yeah.
So if you have dry skin, you don't want to choose a cleanser that dries you out, right? You want to choose a cleanser that may moisturize a little bit more. So gentle cleansers, over-the-counter gentle cleansers tend to work well for dry skin. If you have normal skin, you can do a gentle cleanser or a cleanser with a little bit of exfoliant in it to help exfoliate that surface of the skin to bring out that bright skin. If you have oily skin, you want to use products that will turn down the oil. So products with salicylic acid or benzoyl peroxide tend to help with oily skin, control some of that oil production.
Okay. So let's take it back. I love that. But I think sometimes we kind of don't know exactly whether our skin is dry, oily, combination, or, like I like to say, confused. So how do we know what our skin is, what our skin type is?
When you wake up in the morning and you do this little swipe, if you have oil on your finger, you have oily skin.
Okay. All right, guys, swipe oil. That's oily
swipe oil. If you wake up and your skin feels a little dry or sensitive, that's dry skin. A combination is both. Usually for people with combination skin, they have oil in the T-zone, the T of the face,
Okay.
and they're dry on the periphery.
Okay. Okay. And so all the different, there are ingredients in different cleansers that are going to be beneficial for different types. What are some ingredients we should look out for different types of skin, and what are some red flags for our skin types?
Usually for people with oily skin, you want to avoid oils. You want to avoid products with a lot of oils in them. That's really important. I have a lot of patients that come in to see me and they have really oily or acne prone skin, and they're putting more oil on top of it. So they're making the problem worse. So we want to avoid oils for oily skin. Products with hyaluronic acid, we talked about that, are very good if you need to hydrate the skin, and ceramides without oil. Okay, so you come back and make sure there's no oil. Some people with dry to normal skin will do well with products with a little bit of oil. They can sometimes get that dewy glow with just a touch of oil. And we want oils that are non-comedogenic. And non-comedogenic means non-acne forming. We don't want to use products and we get acne. Okay?
Right.
Mineral oil tends to be non-comedogenic. Some, very few, but some essential oils can be non-comedogenic. Everyone's skin is different. Remember, our skin has an immune system. So that means that my immune system is different than your immune system. So what may work well for your skin may not work well for my skin. Okay. So I always tell patients that they should try a product, use it for about a week, and if they're not getting any type of reaction or any bad side effects, it's probably safe for their skin.
Okay. That's actually really good, because I feel like sometimes we try products and we want to see something happen overnight. And if it doesn't happen, then we're on to the next product. So we've talked about cleansers, but what about exfoliation?
Oh, Jumi, I want to tell you one more thing since you talked. So that's trying it out for a week to make sure that your skin is okay with it, doesn't like have a bad reaction. To get an optimized result from a product, it usually takes a couple of months. So yeah, so you're not going to go on to the next after 1 week if your skin isn't clear and dewy and perfect, right? Usually takes a couple of months for the skin to adjust to the product and to respond to the product. So give it at least 2 months to see if it works for you or not.
Okay, that's really good. Thank you for that clarification. So I did want to talk about exfoliation, because I think that there's certain people that should exfoliate a little bit more, shouldn't exfoliate a little bit more, or should exfoliate less. Tell us a little bit about that.
Exfoliation is very key for skin health. If you have dry or sensitive skin, you want to minimize exfoliation because it can make dry skin more irritated. Okay.
What does minimize mean? Is that once a week, once every couple of weeks?
Once every couple of weeks. Okay. And before you do a full-on exfoliation or scrub, you want to do a little test spot. Right? Before you do it, wait 24 hours. And if you do okay and your skin feels kind of soft and you're like, I'm feeling this, you don't have any type of reaction, then it's probably safe to put it on the whole face.
Okay.
For someone with oily skin, you can exfoliate up to twice a week. I usually recommend once a week for exfoliation. You don't want to go too hard on the skin.
Okay, so wait, some of these exfoliating on the back, they'll say exfoliate like 3 times a week. Why are they telling us that and you're saying otherwise? What's happening here?
Well, some people can exfoliate 3 times a week, but some people do that and then they end up in my office. So we start off gingerly. And then we can titrate up. I usually say start off once a week, and if you're doing great, you can go up to twice a week. 3 times a week might be too much.
Okay. Awesome. All right. So we've talked about cleansers. We've talked about exfoliation. Let's talk about serums when it comes to our entire routine.
Yeah.
How do we incorporate serums into our skincare routine to get this glow?
Serums can be very effective for achieving glow. One of my favorite serums is vitamin C, because vitamin C is an antioxidant, which means it fights off the pollution from the environment. It also protects our skin and can help with hyperpigmentation or dark spots on the skin, help those fade out. A lot of the serums have actives in them, like peptides, vitamin C, that can help just kind of increase our skin health and help it to glow.
Okay. So you mentioned hyperpigmentation.
Yes, it's a big deal in skin of color.
Yes, let's talk about that, because I know that we deal with it. I know I deal with it, and I
deal with it.
Right. And so what should we be doing? What isn't the media telling us when it comes to hyperpigmentation and how we can treat it?
Okay. It goes back to your intro question. So am I answering this or not? Is it going to be a surprise?
No, you can answer it.
Okay. The number one thing for skin health, and it's easy to do, is sunscreen. And this is for every skin type. It's not restricted to fair skin only. Every skin type should wear sunscreen every day. And let me tell you why. The sun ages the skin. It causes something called photo damage, which accelerates the aging process in our cells. So we want to prevent that aging process by wearing sunscreen. That's number one. First and foremost, for anti-aging is sunscreen. It's also number one for hyperpigmentation. Studies have shown that if you wear sunscreen alone, that hyperpigmentation caused by any amount of things, acne, eczema, will fade out with just sunscreen alone without actively trying to treat the hyperpigmentation.
Okay.
So that's number one. First and foremost, sunscreen every day. And remember, on the face, I prefer sunscreens without oils in them.
Okay.
Very important.
So do you have any, because when it comes to sunscreen and black skin, sometimes you put it on and it turns you not black anymore. It's ashy, you know?
Right. It's ashy or purple hue, makes you have a purple hue.
Right. It takes away any glow, any sense of anything, any color. So what can we look out for when it comes to sunscreen that is good for our skin?
You want to look for a sunscreen that doesn't have that glow. And I'll give you some of my favorites, okay?
Okay. Okay.
Some of my favorites include Supergoop Unseen. You can get that. Yep, you can get that usually from Sephora or Nordstrom. It is very velvety, has a very nice texture to it.
Okay.
Also, Elta MD has a lot of science behind their product that you can use. A lot of my patients really like that. It's good for sensitive skin.
Okay.
Also, there is, those are my top two.
Those are your two top.
Yeah, those are my top two.
Okay. So if you're just joining us, we've got Dr.
I have to throw it out there. I do like Black Girl sunscreen.
Okay.
Not on the face, though, for the body.
For the body. So if you're just joining us, Dr. Kaminska has just given us some of her favorite sunscreens that are so important. And we're talking today all about getting your skin glow back, getting rid of COVID face, and getting ready for the spring and summer.
Yes.
That your skin health is ready. Amazing, you know? So thank you all for joining again. Make sure you're liking this video, sharing this episode, and sticking around, because if you tuned in last week, I did a wellness giveaway, and I'm going to announce the winners at the end of today's episode. So keep on keeping on with this conversation, and let's get back into it. So Dr. Kaminska, we know that sunscreen is important for, hyperpigmentation, but it's also really great for prevention of skin cancer.
Yes.
Talk about skin cancer, because one thing I learned was how important it is to prevent skin cancer and how many people die actually, and how we're more at risk, in addition to the Latino population, for dying from skin cancer. So what can we do in our daily routines to make sure that's not an issue?
This is a very good point, Jumi. Skin of color patients, including African Americans or Black people, can get skin cancer. And a lot of people think that skin of color or Black patients are excluded from getting skin cancer.
Right. Mm-hmm.
Skin cancer can happen to anyone and anywhere. Okay. It may present differently. There are three major types of skin cancer. One is called basal cell carcinoma, which usually textbook, you'll see this pink pearly bump on the skin. In skin of color, it will have a type of sheen, but it may not be pink. It may be pigmented or even black with pearly kind of color to it. That's unusual. That usually comes up in sun-exposed areas. I've seen a number of cases of basal cell carcinoma on Black skin on the face.
Mm-hmm.
The other type of skin cancer that's common is something called squamous cell carcinoma. And that is typically kind of scaly and red, and that typically comes up on sun-exposed areas as well. In skin of color, I have seen squamous cell come up not only on sun-exposed areas, but all over the body in different areas, especially in the setting of immunosuppression. So someone who's had an organ transplant or someone with HIV. So we have to keep this on our differential or in our minds, okay? So if you see something that looks kind of rashy, but it's not going away and it's not really itchy and you're immunosuppressed, you should follow up with your doctor. And so the deadliest type of skin cancer is melanoma, okay? This is what Bob Marley died of. A lot of people don't know this. Bob Marley died of melanoma on the foot. And this melanoma on the hands and feet are more common in Black people. So you need to check your hands and feet. If you've got a mole that looks funny to you or is growing or changing, this is a reason to come in. People often don't think about looking at the feet, but melanoma can happen anywhere. And it can happen where the sun does not shine. So it's very important to inspect between our toes and at the bottom of our feet, and also look at our hands and fingers.
Okay. And so that's such great information, because I feel like sometimes we might look at something like, oh, that's nothing, which is what happened with Bob Marley, right?
Right.
He didn't think that he thought it was a foot injury. He didn't realize that it was going to be skin cancer. So are non-Black dermatologists trained to really help us determine what's going on with our skin health? Or what can we do to be advocates to say, hey, I've got this going on, it doesn't seem right, tell me more about it?
So dermatology training, really, this is a kind of a behind the scenes secret, depends on where you train.
Okay.
So non-Black doctors learn the same thing as Black doctors in dermatology training. We learn the same thing. It's about exposure. I did my training at the University of Chicago. Chicago's very diverse. I did it in the South Side. I saw a lot of different skin types. So that's important in getting my exposure. There is a well-renowned dermatologist that did his training at a predominantly white institution, African-American dermatologist, but sought out the opportunity to go to do rotations and get exposure with skin of color. And now he's a skin of color expert. So it is what you make it. The American Academy of Dermatology, that's our home base organization, is really trying to expose the lack of diversity in dermatology and trying to correct for this lack by introducing like slide sets that include skin of color, by getting diversity panels and committees so that the training is standardized. How can patients advocate for themselves?
Yes.
This is a huge deal. I see a lot of patients of all skin types. But in my skin of color patients, especially my Black patients, sometimes they've seen 1, 2, or 3 other people before they get to me. And they are looking for someone that can understand their hair, their skin. And they'll say, that they felt like they weren't heard. So, if you feel like the doctor is not listening to you or giving you what, the time that you need, you can tell him or her, and you just say, hey, I've been to someone else. They've done this before. We have to be self-advocates.
For sure.
We need to stand up for ourselves and say, this is what's going on, and I don't feel like you're hearing me.
For sure. No, that is so important. And so, it's all about making sure you have that communication with the doctor, have the conversation, and don't feel bad if you have to test drive them. If they're not listening to you, if they're not hearing you and trying to really understand your issues, move on to the next one. So I do want to go back to talking about just different things on our face that might be stopping us from having the clearest skin or the healthiest glow. And that is acne and any blemishes, right? So what can we do to deal with stubborn blemishes that just don't seem to be going away?
Well, acne is such a huge topic because, especially everyone's wearing the mask and people think about masks need. Yeah. So first of all, we need to determine what's driving the acne. There are a number of things that can drive acne. One is stress. Stress makes acne come out because what happens when we're stressed? Our hormones go crazy in the body. And then it makes our skin go, wow. So we need to get the stress under control.
Right.
One. 2, certain foods can drive acne in some people. So going back to diet, dairy can be a big trigger for acne for some people. Fatty foods can be a big trigger, and sugary foods can be a big trigger. If you notice that you're consuming something, you're eating that, drinking that pop or eating that cake, and you break out the next day, you got things. Yeah, exactly. Because even though you may be treating it, if you're doing the things that drive it, you're in a hamster wheel. Right? You're not going to get anywhere. So we talked about stress, we talked about diet, and sometimes hormones can be a big trigger for acne, especially with women around the menstrual cycle. Sometimes acne blemishes will come up on the face. And so making sure that your hormones are okay if you have a gynecologist checking in with him or her. So those are those are some of the major causes. So we can control those things. The acne won't come. We won't have hyperpigmentation. We'll be happy go lucky. But what do we do when the acne is there?
When it's there and it won't go away.
It won't go away. It won't go away. It depends on the skin type, obviously, but
Okay.
certain things you can do over the counter would be to get a cleanser with salicylic acid.
Okay. Is this for all skin types or are you talking specific ones? Or can we say, okay, for dry skin, do this, oily skin, do this, confused skin, do this?
For all skin types, salicylic acid is a mild, very gentle exfoliator that helps unclog pores.
Okay.
The question is, which salicylic acid should you try? Cleanser should you try, or benzoyl peroxide should you try? And that's skin dependent. So you would need to try some over the counter. It might be a trial and error, and make sure that your skin doesn't react poorly.
Okay.
So salicylic acid, benzoyl peroxide are good over the counter starts to getting the skin, the pores exfoliated.
Okay.
That's one. Then you want to make sure you're not using any products with oils that can block pores, right? We talked about oils blocking pores, so we don't want to put oily products on our face. This is a common mistake that my patients make when they come in to see me. They're using all these products, and a lot of them are chock full of oil, and their acne is not going away. You want to look at the back of the label and say, hey, is there a lot of oil in here? If there's a lot of oil, we want to kind of put that product.
What are some of those oils? I mean, mineral oil. What else are some of the other oily ingredients that we should be looking out for?
Mineral oil is a non-comedogenic or non-acne forming oil. So if there's mineral oil, it's usually not going to contribute to acne.
Okay.
There's all kinds of oils that are in products. There's grapefruit oil and sunflower oil and just you name it, essential oils. There's all kinds of oils. You want to try to avoid products that are oil heavy for acne prone skin. This is super important. Okay. And a lot of things over the counter have a lot of oils in them. And so when I have these patients that the acne is not going away, and we sit down and I look at their products with them, they bring it in, we look at it together. It's like, this has got a ton of oil, this, and this. And so we exclude those things.
Okay.
Okay. Other things that can help with acne are retinols. And retinols are good for anti-aging, and retinols are good for acne. Retinols are vitamin A derivatives. So they're a topical formulation of vitamin A that can help exfoliate and clear the skin and also help with fine lines and wrinkles.
Okay. So with retinols, are those those are things that you can just get over the counter, but are they also part of some of the cosmetic treatments that you do for people?
Retinols over the counter, like you said, you can get it over the counter. In the clinic, we do prescription retinoids, which is in that vitamin A family. We have products such as chemical peels with retinol or retinoids that can help exfoliate the skin faster.
Oh, so it does faster. So let's talk about some of these treatments, because I feel like, people feel like it might be taboo to get some treatments done, but they can really jumpstart your skin health routine, right?
Oh, 100%.
All right.
Chemical peels. So we do chemical peels in my office, and what it does is helps peel the skin. So it gets rid of that top layer, that dead top layer, that dull layer. It might help with that hyperpigmentation or dark spots, and jumpstart getting at least the first layer off, and then we can kind of get into the nitty gritty. There are different types of chemical peels. We have mild peels, which are just, you get fine peeling. We've got medium depth peels, which kind of peel a little bit more. And then there are deep peels, which kind of peel off the top layer of the skin, which is more intense. But they're fun. Patients get that immediate satisfaction, usually within a week, and some difference with their skin. And that kind of motivates them to come back. I need to tell people one peel is not enough. It's not a one and done, but it might be a good jump start.
So how many times do they have to come back for a chemical peel? It seems intense.
It usually depends on the peel. It can be anywhere from 3 peels to 6 peels on average to kind of get the optimized results. And it's not as scary as it seems. There are so many YouTube videos out there with people showing like the snake skin, but peels vary in intensity and in the provider's hands. So a superficial peel might get barely noticeable. You might not notice anything at all. Whereas a deep peel where you've got, like I said, that snake skin where it really comes off. So there are different depths of peel.
All right. So chemical peels are not bad. Somebody had a question about collagen.
Yes.
Talk about that.
Yeah. Collagen is, so there are 3 layers of the skin. We've got our epidermis, which is what we see, hence this. And then when you take that top layer off, it's our dermis.
Okay.
And our dermis is what's chock full of collagen and hyaluronic acid. And this composes the matrix of our dermis. And collagen gives us that youthful plumpiness, right? So it gives our beautiful cheeks, nice round face. And so as we age, our collagen gets thinner and not as plump. So we try to.
At what point at age? Like, I need to know.
Everyone's different, and lifestyle plays a huge factor. So going back to that healthy diet, avoiding smoking, wearing sunscreen, these are all things that kind of preserve our skin and skin health. Usually people start aging probably in the mid to late 20s, but also depends on lifestyle. So if you smoke, if you do drugs, if you eat like horrible food, you're going to age a lot faster. Part of it is genetics too. Some people have really good genetics that they don't age that much. They are the lucky few. They are the lucky few. But collagen is a substrate in our skin. It's a protein that is the matrix of our skin that gives us that healthy glow. So there are things that we do in the office that can stimulate collagen formation.
Like what? I'd love to know. I'm sure the viewers would like to know too.
Yes. So we can kind of reactivate that collagen and get it to thicken up with laser treatments. So laser is an energy source that is full of energy that stimulates the collagen and can stimulate the collagen to kind of grow or become thicker, which is what we want for anti-aging. We do something called microneedling in the office. Have you heard of microneedling, Jumi?
I've heard of it, but when someone says needles, I kind of tune out. So you can talk about that.
Well, don't tune out. Let's tune in, because needles can be very good for stimulating collagen. And what we do is we actually put numbing on the face so that you don't feel it. It's not painful. So you don't have to tune out and tune in. It will numb the skin, so it will be anesthetized. And then we needle the face. We use this device that will needle the face and create these little micro channels and micro holes in the skin, poking the collagen to make it to grow and become thicker. That can also help with acne and acne scarring, by the way.
Okay. So all of these procedures, A, are terrifying, but B,
You're not terrifying, I promise. When you come in, it's not that bad.
How often do you have to do them? I guess my question is like, what can we do in addition to going into the office for these cosmetic treatments, plus at home, because I'm sure they're expensive, but they're also just time consuming? Or like, what is the process for maintenance?
For maintenance, yes. So usually I put my patients on a good skincare regimen. This is customized. So we talked about general products that you can use to kind of maintain skin health. Usually I provide a custom treatment protocol for my patients. Everyone's skin is different and how they respond to things is different. So that does take time to get to know someone's skin and what to do for it. Okay. What we talked about earlier with the healthy diet, sunscreen, vitamin C, these are simple, easy to incorporate things that you can do at home to at least get that routine going.
Okay, so there's a lot we can do at home, plus coming into seeing a fabulous doctor like yourself to really get us going.
Yeah.
So Nana had a question, and her question is, what about PRP injections in the skin?
PRP. So this goes into the microneedling.
Okay. What does PRP stand for?
PRP stands for platelet-rich plasma. Ooh. And platelets are a component of our blood. So how does that work? We take a syringe and get the blood out of the vein. We'll centrifuge it or spin it in the lab, and it separates the blood into components. Okay. At the top are the platelets, platelet-rich plasma. And then we aspirate this out of the tube and use it as a substrate for microneedling. Our blood has growth factors that can help stimulate the skin to rejuvenate it and make it fresher and brighter. So that when we use it as a substrate for the microneedling, that plasma goes into the skin to rejuvenate those cells.
Whew. Okay.
It's not painful, Jumi. I'm gonna have you come to Chicago and try it out.
I feel like I have to because you're telling me a lot of things that sound amazing. I feel like they're gonna be really great, but I'm like,
Yeah.
whoo, this is totally different. So are there some treatments that you do? So you do treatments for acne, you do treatments for the, collagen stimulation. What
Yeah.
about eczema? What
Oh,
can
yeah.
you do at home and in the office to treat eczema?
Eczema is, do you guys all know what eczema is? Eczema
How
is,
about you tell the viewers what eczema?
yeah,
Yeah.
eczema is a rash the body produces that's not contagious, it's not infectious, it just kind of pops up and it can pop up anywhere, it can pop up at any time, tends
Hmm.
to be itchy and dry and scaly and can cause a lot of discomfort. So typically the way we treat it at home, you can go for a nice sunny walk if you live in Los Angeles, like Julie, right? Sun has anti-inflammatory properties that can help slow down and calm rashes such as eczema.
Hmm.
That's one. Gentle skincare is really important. I would avoid things with fragrance or perfumes or scents, especially if you have eczematous skin, because those scents and fragrances can sometimes irritate the skin. So choosing a nice, gentle, scent-free, fragrance-free cleanser and moisturizer are important for eczema.
Mm. Are there any specific ones that you recommend?
Oh, there are many. So I like Aveeno Baby Eczema or Eczema Baby line. I like Cetaphil and CeraVe, and I love Vandy Cream because it's made for sensitive skin.
All right. So, y'all, she has given you some amazing products to use, some cosmetic treatments to get. Like, I'm like
Yes.
absolutely loving this. Okay. So, you talked about eczema, but then there's psoriasis, and then there's just like dry skin. What is the difference with all of these three?
I know it can be so confusing.
Yeah.
So dry skin is also known as ashy skin. If you could kind of scratch it, and you see some dryness, that's dry skin.
Okay.
Eczema is a little bit more severe than just dry skin. You get
Okay.
kind of scaly, itchy patches that can sometimes crack, sometimes bleed in some people. It's very uncomfortable. Psoriasis is an immune-mediated condition where people get, in skin of color, it looks different than in fair skin. And fair skin it usually looks like pink and very scaly, thick patches, okay? And skin of color usually comes up as like more hyperpigmented or dark colored patches, darker than your regular skin. Like it could be dark brown with a scale on it.
Oh.
Yeah, with scale on it. And it can be anywhere on the body. People often get eczema and psoriasis confused.
Right.
It's best to be evaluated by a dermatologist to determine which one you have because the treatments can vary.
What are the treatments for the different conditions?
Usually for dry skin, it's about moisturization and hydration.
Okay.
So let's talk about the difference between those two, hydration.
You read we here. You just read my mind.
uh, okay, hydration stands for water. It's getting water into our cells and into our skin, right? Moisturization means keeping it there. So taking a shower bath every day will hydrate the skin.
Okay.
But you don't want to stay in the shower bath too long because it can dehydrate. So imagine like a cup of hot tea. You've got the hot tea, the water's there, and then it starts evaporating, right? You let it stay too long. So what moisturization does is we put these creams or products on our skin to trap that water in the cells so the cells stay hydrated.
Okay. And so what are some of the best products for both? What can we go to our local CVS and be like, all right, I need this for this, I need this for this. We're trying to get our glow back starting today.
I know there's so many different products. Okay, for the hydration, if you have dry skin, I mentioned some of my favorite brands: CeraVe, Cetaphil, Vandy Cream, Eucerin. These will really help keep the hydration and moisturize our skin. That's super important to make sure our skin is moisturized so we don't look ashy. You know, summer's coming up. We don't want ashy ankles.
Yeah, we want summer glow, not summer ash.
We want summer glow, not summer ash. Exactly. And that's for the body. You want to make sure that we're using for facial products for face. Some of the body products we're not going to put on our face. It can be too heavy and contribute to breakouts. Okay. For eczema, you want to use things that say for eczema in them because they usually are chock full with super hydrators. that
Mhm.
will kind of seal that moisture in the skin and keep it there and last longer. Usually people with eczema need to reapply their moisturization multiple times a day. It's not just a one and done.
Mhm.
If they get dry or itchy, they'll need to use it a couple, 2 to 3 times a day at least.
Okay. What about lip care? I feel like the lips and the eyes tend to be very specific types of care that
Yes.
we need to practice. So let's start with lip care. What are some things that we should be doing for our lips daily? Are there any cosmetic? Well, we know they're cosmetic treatments, but like, what should we be doing at home to treat our lips?
Well, for the lips, usually drinking water, healthy diet. I keep going back to these things over and over because they're so essential because,
Okay.
this is our foundation. If our
Mhm.
foundation is weak, then everything else we do will help just a little bit. Okay.
Okay.
So healthy diet, drinking lots of water. I like lip balms with sunscreen in it because our lips need sunscreen too. Okay.
Definitely. Yeah.
Smoking can make the lips discolored. I see a lot of smokers that have dark lips. So try to stop smoking. And that includes both cigarettes and marijuana products.
Mm-hmm.
It can darken or discolor the lips. So
Mm-hmm.
a lip balm with sunscreen is a great start. And even plain petrolatum or Vaseline is great for the lips. Some
Okay.
people like a lip exfoliator or lip scrub. It can
Right.
remove some of the dead skin. Like I like sugar-based scrubs because sugar is a natural product, right?
Right.
That will help get rid of some of that dead skin. If your lips are very dry and cracked and not responding well to any of those things I had mentioned, you might have a lip rash. And
Mm.
lip rashes look very different on the lips than on the skin. So it would be a good idea to get evaluated.
Okay. And so with the sugar scrubs, is that a sugar scrub that you can make at home that's got like honey and lemon, or is it
Mhm.
over the counter? Are those pretty much on the same boat when it comes to sugar scrub?
They are. You can make it at home
Mhm.
if you like. You want to make sure that it's not too sticky. But the sugar acts as a natural exfoliator. The honey acts as an anti-inflammatory.
Okay.
So using those two ingredients and creating your own concoction is safe.
Amazing. That's good. Okay, so now let's talk about eye care.
Eye care, super
So
important.
eye care, dark circles around the eyes. I know so many women are always thinking about that because they can get everything else going, but it's just the eyes that they still might have issues with. So, what are some suggestions for treating our eyes?
So I love CC and BB creams with a little bit of sunscreen to dot around the eyes. This helps protect the eyes, not only from the sun, but anti-aging around the eyes, these dark circles under the eyes. There are creams over the counter that have caffeine in them. Caffeine constricts blood vessels because blood vessels, as we age, our skin gets thinner and thinner and thinner. Our collagen gets thinner, our skin gets thinner, and hence gravity pulls the skin down, causes wrinkling and thin skin. So those blood vessels sit closer to the surface, and that contributes to dark circles underneath the eyes. So caffeine can constrict those blood vessels so they're less noticeable, so we don't have those dark circles under the eyes.
Mm-hmm.
Cucumbers. So there's some truth to this adage. Wearing the
Oh yeah, when you're like doing a spa day and you've got a
yes,
cucumber. Okay.
tea bags. There's some truth to this adage.
Oh.
Yes, very much so. So tea bags with caffeine, caffeinated tea bags can help. These are like natural tricks to the trade. And cucumbers have anti-inflammatory calming properties to them that can help as well. So when you're looking for an eye cream, if you have dark circles under eyes, look for the products that contain some caffeine. This can help with under eye circles. Niacinamide is another popular ingredient that a lot of my patients are coming into the clinic with. Niacinamide is a derivative of B vitamin, and it can help with, it has anti-inflammatory, antioxidant properties. So a lot of the eye creams now will have some niacinamide in it to calm down this dark circles under the eyes and give the antioxidant properties from the environment.
I love that you said that the cucumbers and the tea bags can actually
This
be.
is real.
I love that's like the first thing on the TV and the movies that you see. You're like, oh, I can actually do this at home and it works.
Yeah.
How often should we be doing that?
It depends on the person, but if you do it 1 to 2 times per week, that should show some difference. Caffeinated tea, not organic, non-caffeinated. We need
Not
caffeine.
chamomile tea.
Yeah, not chamomile. So chamomile does have anti-inflammatory properties, but to get rid of the dark circles, you want to go there.
Yes, Latanya says she needs to try it. Me too, Latanya. I do too. I want to try some tea bags. I've never done that before. What about fine lines around the corner of the eyes?
Fine lines around the corner of the eyes. That's a little bit more tricky. Retinols help with that. Remember, we talked about retinols or vitamin A derivatives that help with fine lines and wrinkling. Sunscreen will help with that. Vitamin C will help with that. In the clinic, a little touch here, touch there of neuromodulators like Botox or Dysport can help around the eyes, soften the corners of the eyes very easily and naturally.
Okay, thank you so much. All right, I've got, one more thing for you guys. We have another dermatologist that's just joined us, and it is Dr. Michelle Henry. And I know she does a lot of work with Hi, Henry. So good to see you.
Good to see you both.
Thank you for jumping in with us. I know Dr. Kaminska was just talking about Botox and injections. And I know that you do a lot of, because you do a lot of dermatology surgery. You do cosmetics. How about you just jump in and tell us more about that? And like how many people are getting these injectables done, and are they liking it? Are they talking more about it? Is it becoming more accepted?
Yeah. Absolutely. I can tell you my thumb is hurting right now from injecting.
Where are you based?
I'm in New York City.
New York City,
yes. And so we are seeing more and more of it. I'm seeing more and more of it every day. And I think a part of it, beyond the Zoom effect, we've been calling it the Zoom effect. We've been at home staring at our faces at angles we've never seen our faces before. Mm-hmm. I also think that during this time, a lot of us have been looking at social media, learning about treatments, learning more about neuromodulators, learning more about fillers, learning more about these procedures that maybe once upon a time we thought weren't for us,
Yeah.
Coming in with real questions, real interest, less fear, because a little bit of it's been normalized. And so I'm seeing more and more and more women of color coming in, having these treatments, having fantastic results, and being really happy. So yes, we do a lot of it.
I love it. What are some of the more common treatments? And is there an age, like an average age of people, or is it across the spectrum?
It's across the spectrum because we all eat differently. We all know we're speaking of old adages, black don't crack. Well, crack, but black does sag and sink and fade.
Mm-hmm. Ooh, black don't crack, y'all, but it sags, sinks, and fades, and we don't want any of that.
Exactly. So we still require maintenance, right? And we should also have the luxury of all of the peels, the injectables, the lasers that everyone else has. And we do. It's just about making sure you're seeing a physician who understands how to use these tools safely for your skin, who understands the specific techniques to keep your skin safe, and to make you look natural, and understands your aesthetic, because that has been a problem in the past. So we've been forcing black and brown faces into aesthetics that don't look good on us, that don't meet our needs, don't serve us, and don't reflect what we really find to be beautiful. So yeah, I'd say one of the most common, I love that you guys are talking about eyes. That's just when I kind of tuned in. I treat a lot of eyes. I probably do more under eye filler than anything else for many reasons. Because we don't crack, but we sink, we're a little bit flat here in the mid-face. Because we're flat here in the mid-face, we start to notice those little eye bags popping out a little bit sooner. And so I treat a lot of eyes in women of color. I use a lot of filler in that area. I use a lot of Botox on the crow's feet sometimes, but definitely I do probably more filler there than even some of the neurotoxins.
Is there, in addition to the eyes, is there another area for Black women that you're injecting more often than other women of other?
So I'm doing eyes, I'm doing lips on Black women, which I used to not do years ago, but even fuller lips. There are two ways that we inject lips. We inject lips for fullness, but also for structure. And so, having a nice firm, we call it the vermilion line, but the border of the line of the lip, having a nice firm, a nice little cliff is what I call it, is very youthful and very beautiful. And so a lot of women want that. Lots of jawlines. So I'm doing jawlines. Everyone wants that nice sharp jawline. I'm doing lots of chins. And I'm also doing cheeks, nothing, it really makes the face really beautiful when we lift that cheek and we highlight the eyes. So, really I'm doing all things in all women, but those are probably some of the top areas.
And just to add on to Dr. Henry, also the mid-face, like she mentioned, these lines from the nose to the mouth.
Exactly. How did I forget that, right? In some parentheses, focusing on the exotic things, but you're absolutely right. those parentheses we're attacking all the time as well.
So what do you think it is that women are getting more comfortable having these conversations and coming and saying, hey, like, I want this done? Like, what is it?
I think it's becoming normalized. It's doctors like me and doctors like Dr. Kaminska coming in, talking online, saying that this is what we do, this is what other women are doing. There's less taboo, I think a lot of, initially when I started practicing, a lot of my patients are saying things like, does Botox work for Black skin?
Right.
And I would have to tell them, the muscles are all the same, 90% of our genes, I think it's 4% of our genes have to do with like racial differences in phenotype. We're all the same. And Botox works on all of our muscles. That's universal. And so Botox works beautifully. I use Botox not only for, softening muscle movement, but also for skin quality. So I'll use really dilute Botox for large pores. It's one of the best ways I find outside of lasers to reduce the pores. So I think it's conversations, it's education, it's the reduce, we a lot of people are seeing their favorite celebrities sitting in a doctor's chair having their injectables. And so it's becoming normal and it's not taboo. And people realize that we don't crack, but we sink and we fade and we go. We can take care of that, right?
It's taking away that fear, like Dr. Henry mentioned, is taking away that fear and trusting your provider, and and it's very important for people to see people that look like them.
Yeah.
Because it's just important. Some people, I get that almost every single day. I was looking for you. I was looking for someone that looks like me. And I mentioned before that we get the same training, but it's about exposure.
Yeah.
It's so much is outside of your training. Just like you said, the more you do it, the more you see it. It is very hard to learn. As much as we try, it is very hard to learn to read skin from a textbook, especially when you're doing things like using laser devices, using energy devices, where every second matters. Every time that laser interacts with the skin, reading how it swells, understanding that redness doesn't look the same on brown skin, that is critical. And just like you said, that comes from experience and seeing lots of brown skin.
Right. Well, I appreciate y'all because this information is amazing. I've got a couple questions that I want to pull up. So this first question is from Adriana, and she wants to know, what do you think about thread lifts?
I guess I'll start. I like thread lifts. They're not for everyone. So I think there are a lot of people who overutilize thread lifts. So when someone who has a really full cheek, if we're lifting you here, we're just pushing that cheek right into your eyes, and that's not going to look natural or normal. So you need someone who's not just, using it for every patient, but I think in the right patient who has maybe a thinner face and has some laxity, it can work. I don't like it on the eyes. I've seen a lot of patients, I forget what they're calling it, the fox eyes. That's the Instagram thing where people are doing threads on the eyes. That can end really poorly for you. You can get scarring around the threads, especially if they're using the thicker, more aggressive threads. So I do like it in the right place for the right skin type. There are thinner threads and then there are thicker threads. So some of the thinner threads are really just there to lay down collagen. Those are probably are okay. And those thinner threads are probably a safer bet. But some of the thicker, more barbed threads, which give you more lift, you have to be very careful, and you need to go to a physician who understands how to use them because you can't have complications. So for the right patient, I like them, but you have to be careful with all things and selective as to who you go to.
For sure. Okay. Thank you so much. There's another question from Kayla, and is there a benefit to microdermabrasion versus a chemical peel?
Go
ahead, Dr.
I guess.
No, go for it, Dr. Yeah, for sure.
Is there a benefit to microdermabrasion versus a chemical peel? Downtime, right? So I'm a big fan of chemical peels. I'm like a evangelical when it comes to chemical peels. I do them all the time. We do 1 million in the office. It's going to give you deeper exfoliation. It's going to be better at hyperpigmentation. Using the right peel can even stimulate a little bit of collagen. You can get some kind of tiny tightening if you're doing the right peel, a tiny bit of lift. You're not going to get that with microdermabrasion. However, with microdermabrasion, you don't have to peel. And so if you're someone who doesn't have the downtime, you're not going to get the same results. But if you want just a little bit of a glow, you want your serums to absorb a little bit better. Maybe you're suffering with a little bit of clogged pores. You want to remove a little bit of that congestion. Then a microderm is a good way to go. I would say the singular benefit of microderm over a chemical peel is that you don't have the downtime.
Yeah. And I agree with Dr. Henry. I love peels. Like I mentioned before, there are different depths that peels can go. There's superficial peels where you don't peel a lot and you still get that benefit, like unclogging the pores. And I feel like peels usually are more controlled within the right hands. You have more of an understanding of how deep it's going to go.
Exactly.
Can you do a chemical peel while you're pregnant?
Go ahead.
I'm very conservative.
Me too.
Hyper, that precious cargo. I say just focus on that little.
Focus on the cargo.
Exactly. Focus on that cargo. Some will. There are some peels very, very low percentage glycolic acid peels. Lower than 10%. But you know what? It's not worth it. I would say, the things that I use when you're pregnant, I use azelaic acid, which is very safe during pregnancy, during when you're breastfeeding. But I would stay away from, doing chemical peels while you're pregnant. You can use like over-the-counter glycolic acid if you want. Again, not super strong concentrations, very low concentrations, no salicylic acid, no retinoic acid.
Right.
You can try a little bit of lactic acid, that's milk acid. But
benzoyl peroxide.
But you really want to stay away from anything more aggressive when you're pregnant. Just focus on your little precious cargo, and we'll take care of everything on the back.
Yeah, we'll be waiting after you have the cargo.
After the baby. All right. So, like,
take care of.
The final question, which I'm sure is on everybody's mind, and we didn't even talk about this, but can makeup be really damaging to your skin in the long run?
It depends on the type of makeup, right? So makeups that are chock full of oils or silica can damage the skin over time. We want makeups that allow the skin to breathe, that are more natural-based products can help the skin. And also makeups that are acne forming, right, can damage the skin because acne causes inflammation in the skin. And we want to make sure the pH is normal and calm and healthy.
Yes, and there are some, and I must say that I work with Clinique. I'm one of their derm pros, but they do have a makeup. They're creating some makeup lines that are good for the skin. So they contain ingredients like salicylic acid. I don't think that Clinique is completely unique. There are other brands that are doing it, but it's one that I use and I like. But it has salicylic acid. It has some brightening ingredients, so it's going to help to unclog the pores. It has different serums in it to brighten the skin. And as I'm seeing, and I work with a lot of other companies, that's becoming a trend, is smart makeup that has skincare ingredients. It's kind of the skinification of everything. We're seeing the skinification of hair care, the skinification of makeup. So we're understanding the importance of those ingredients like hyaluronic acid, even in our makeup. So I think with time, we're going to see more of that on the market. So yes, I agree. It can be really bad for you. And if you're having difficulty finding one, look for a smart makeup, because sometimes we say don't wear makeup, but if you have so much hyperpigmentation, you can't really live your life without concealing it. So if you're someone who has to find a way to conceal it, look for some of those smart products with those ingredients so that you're helping yourself and not hurting yourself.
What about when it comes to removing this makeup? Sandy has a question. Is it about, how about micellar water to remove makeup? Is that bad for the skin?
Not necessarily. Sorry, I
was going to say
I'm a loud mouth.
Micellar water well, you came on late, so Dr. Henry, feel free because I talked for a lot. But micellar water, I do like it, but you have to follow up with another cleanser. You don't just use that in and of itself. You'll use it to take off the makeup, and then you'll apply another cleanser to remove the oils from the micellar water.
Yeah, I absolutely agree. If you're choosing between a micellar water and a makeup remover, if you're hypersensitive, I'd still go with the micellar water over the makeup remover. It's going to be more likely to be an irritant to your skin if you're sensitive. However, micellar water is still has surfactants in it. That's what makes it a cleanser. So it's not like you're just using water. It's still something that needs to be rinsed off. And so I think the biggest misconception is that because it's called micellar water, it's just like using water or a baby wipe. It's not. It's a cleanser because it's still a surfactant. And so you still have to rinse it off just like it was said.
What about avocado oil and removing makeup? Is that good?
Avocado oil in some ways is a bit of a naughty oil. So we
stay away from it.
Yeah, we avocado.
Pardon?
You said stay away from avocado, Dr. Kaminsky?
Not necessarily. So, but maybe, right? Like we grade oils based on like how likely they are to clog your pores. So like super likely is coconut oil. That's like a 4 or a 5. Avocado oil is around a 2, and grapeseed oil, for instance, is around a 0 or a 1. So if you must use an oil to take off your makeup, use grapeseed oil instead of avocado. Now, if you're someone who's really not prone to clogged pores, maybe you're okay, but I'm still not a fan of it because, I'm not super prone to clogged pores, but if I use avocado oil, I'm going to have a few. So if you have to use an oil, use more like a grapeseed oil, stay away from an avocado, stay far away from a coconut oil. And even J-Lo's olive oil is more like a 2, so it could clog your pores. It's like a 2.
Right.
So it's all about the grapeseed oil for
Yeah.
any oils on your faces.
Yeah.
Wow. Okay. Well, you all have given us so much information over this past hour or so. And I'm so grateful. And I know everybody watching has taken in so many tips that they can start incorporating right now. We're all going to go throw away all the nonsense that's in our, bathrooms and go get the right products and really start to improve our health. Like fresh, glowing skin is right in front of us, just waiting to be revealed. And we just have to start working on our routines and doing what we need to do. So you all, I want everybody to share this episode because I know there are people in your life that need to hear this information. You do not need to wait 3 months to go see a dermatologist. You got these ladies right here that just gave us so much information, and this video is going to be on replay forever. So make sure you rewatch it. Keep sharing it, keep liking it, and keep incorporating this stuff into your daily routines. But don't go anywhere yet, y'all. I do have an announcement to make, and that is to announce the winners of last week's giveaway. Are y'all ready to know who won the things from last week? Congratulations to So please make sure you email me. Congratulations to you all. Thank you all for being such a fun and engaged audience. Thank you for tuning in week after week. I have so many more conversations coming up this month, but you're just going to have to tune in to know more about it. So I will see you all again next week, same time, same place. Thank you, Dr. Kaminska. Thank you, Dr. Henry. And I will see you all next week.
Bye, Jumi. Thank you. Bye, Dr. Henry.
Bye.